Hello, today my name is Isabella Gozo and I'm going to be your nursing student. I'm going to be doing sectioning your trach and changing it out here. So the first thing I'm going to do is close the curtains, raise our bed up to a working height, and put her in semi-Fowler's positions. Hi, Miss Jones, what's your name, date of birth? I'm going to check her wristband, make sure everything's all good. And I'm going to explain to her what we're going to be doing today. We're going to be checking your trach and changing it out for you and sectioning it. If you have any difficulties or anything, just raise your hand and don't grab at anything. Okay. So first thing we're going to do is going to check our sectioning is on, and then we're going to put that, it should be 150, and then our oxygen should be from 10 to 15 liters on, and we have our ambu bag, make sure that's here, make sure this is working, this is on, okay. And we're going to put this chuck underneath on her chest to make sure she doesn't get anything on there. We're going to be doing that, and then we're going to be removing this also for later. Okay. And we're going to make sure we have a garbage can and everything like that here. Then we're going to perform our hand hygiene again after I put my goggles on and my shield. So I should do that first. Okay. So we're going to open this up. Put that there. And then put our saline in here and open our sterile gloves up. I shouldn't have touched my glove right here. So we're gonna wrap this around. The right hand's gonna be sterile and your left is gonna be not. So we're gonna connect it right here. First, we're gonna give her some breaths first, like our left hand. This is supposed to be connected, but this one won't. Oh, we're gonna pretend it's connected. We're gonna give her 3 to 6 breaths. So we're gonna dip this in saline. And then we're only going to insert it to the hospital policy, whatever that says. It should be connected here. Okay, we're going to go in for no more than 10 to 15 seconds and twist coming out. Okay, and make sure she's all good and everything like that. I'll drop this and give her more breath. So we're also going to dip it in the saline again. And then we're going to reinsert. We can do this up to 3 times. And then in between each, we should give like 30-second break. Okay, that's perfect. Now after we're done doing that, we're going to remove and put this into our glove and get rid of this. That should be like folded up into my glove. Okay. Then I'm going to perform hand hygiene again and open my next tray up. I'm going to put some saline in there. Oh, we should have also taken out, before I remove those gloves, we should have taken out this tube. So I'll just pretend I have my gloves on still. Okay. But we're going to be using this one because we don't have another, so we'll put it right here. Okay, so our saline's in there. Okay. So the first thing we're going to do is we're going to take our saline here and do each for the quadrants, 1 Q-tip per quadrant. Okay. Then we're going to be reinserting our new one. Make sure it locks. Okay, so then after that, we're gonna have another nurse help us here. And we're gonna take this off and put a new little valve in here. Someone should always be holding this in here. Okay, so then we would have them remove this. Since we don't have another one, we're just gonna pretend this is the new one. Before we did this, we should have checked and listened to our lung sounds first. Make sure this is needed. And then after we're done, we're also going to check again. This should have 2 finger in there. Okay. Okay. Are you comfortable and everything up to that? We're just going to get her cleaned up now. And we would suction her mouth if she feels like it's necessary. Or I'll look in there and make sure, does she need any suctioning, and I'll just use this. If there is any. No, I don't see any, so she's good. We're just going to clean her up and offer her oral health, and that's all. And we're going to check her lung sounds afterwards.